Hello and welcome. Today, we're diving deep into a fascinating and often under-recognized kidney condition called medullary sponge kidney, or MSK. We'll explore what it is, what causes it, how it's diagnosed, and what you can do about it. So, let's get started. The exact cause of medullary sponge kidney remains largely a mystery. Most researchers believe it's a congenital condition, meaning you're born with it. However, it's typically not inherited in a straightforward way, so family history isn't always a clear indicator. There's also speculation about potential links to certain genetic mutations or disruptions during kidney development in the womb, but further research is needed to solidify these connections. Now, let's talk about what's actually happening inside the kidneys. In medullary sponge kidney, the small tubules within the medulla, the inner part of the kidney, become abnormally dilated and cystic. Imagine tiny balloons forming inside these tubes. These cysts trap urine, which can lead to several problems. Calcium deposits or kidney stones are common in these dilated tubules. The altered structure also impairs the kidney's ability to concentrate urine, potentially leading to increased urine production and dehydration. While it's difficult to pinpoint exact numbers, medullary sponge kidney is considered a relatively rare condition. Estimates suggest it affects around 1 in 1,000 to 1 in 20,000 people. However, many individuals with MSK may be asymptomatic or have mild symptoms that are overlooked, meaning the actual prevalence could be higher. It seems to affect men and women equally, and diagnosis usually occurs in adulthood, often during investigation for kidney stones or other urinary problems. The symptoms of medullary sponge kidney can vary widely. Some people experience no symptoms at all, while others suffer from recurrent kidney stones, which can cause intense pain in the side or back, radiating down to the groin. Other common symptoms include blood in the urine, also known as hematuria, urinary tract infections, or UTIs, an increased frequency of urination, especially at night, a condition called nocturia. In some cases, SK can contribute to kidney infections and, rarely, even kidney failure. Diagnosing medullary sponge kidney usually involves a combination of imaging and urine analysis. A special X-ray called an intravenous pyelogram, or IVP, is often used. In an IVP, a contrast dye is injected into a vein, which then travels to the kidneys. The dye highlights the characteristic cystic appearance of the dilated tubules. A CT scan can also be helpful. Urine tests can reveal abnormalities like high calcium levels or signs of infection. It's important to note that MSK is often diagnosed after someone experiences kidney stones, prompting further investigation. While medullary sponge kidney itself doesn't have specific subtypes in the traditional sense, the severity and presentation can vary. Some individuals have widespread involvement throughout both kidneys, while others have more localized disease. The presence or absence of kidney stones, the frequency of UTIs, and the overall impact on kidney function are all factors that contribute to the individual experience of MSK. Unfortunately, there's no cure for medullary sponge kidney. Treatment focuses on managing symptoms and preventing complications. For kidney stones, options range from conservative measures like increased fluid intake and dietary modifications to medical interventions like medications to dissolve stones or procedures to break them up, such as lithotripsy. Preventing UTIs is also crucial and may involve antibiotics in some cases. Maintaining adequate hydration is key to diluting urine and reducing the risk of stone formation. Dietary adjustments, such as limiting sodium and calcium intake, may also be recommended by your doctor. Because medullary sponge kidney is thought to be a congenital condition, there isn't a definitive way to prevent it from developing in the first place. However, if you have a family history of kidney stones or MSK, it's wise to discuss potential risk factors with your doctor. Maintaining a healthy lifestyle, including staying well hydrated and following a balanced diet, can help promote overall kidney health and potentially minimize the risk of complications. The prognosis for people with medullary sponge kidney is generally good. Most individuals can lead normal lives with proper management and monitoring. While recurrent kidney stones and UTIs can be challenging, they can often be effectively managed with lifestyle adjustments and medical interventions. Researchers are continuing to investigate the underlying mechanisms of MSK, exploring potential genetic factors and seeking to develop more targeted therapies to prevent stone formation and preserve kidney function. Ongoing research offers hope for improved management and potentially even preventative strategies in the future.